As soon as the baby is born, along with the many other concerns parents have about their baby, the one bigger concern which really bothers them is immunization or vaccination. To confuse them, there are many vaccines in the market. There are many kinds of vaccine, the painless ones, the not so painless ones, etc. And of course, there is a cost to these vaccines. In my today's talk, I would try to simplify vaccination and immunization for your child, and I also would reinforce and tell you how important vaccination is. Vaccination is one of the most important things for children whose immunity is still developing, and vaccines work by strengthening the child's immunity against a variety of viruses and bacteria which can otherwise cause disease in children. So this is one of the easiest way to protect your child from diseases and keep them healthy. Vaccines are available for a variety of diseases, right from polio to diphtheria, which presented with cough, fever and a white membrane on the throat. Tetanus, I don't know how many of you know what's tetanus, or dhanurvad as it's commonly called in Hindi. Pertussis or kali khasi, jaundices of variety of types, measles or devi that is commonly called, chicken pox, and the list is endless today because we have very many new vaccines in the market for other diseases like a cervical cancer vaccine, or you may have heard of a liver cancer vaccine, that is the hepatitis B vaccine, or you have many other new vaccines which are essential like the typhoid vaccine or the MMR, which is the measles, mumps, German measles vaccine. So the list is ever growing. Do we need to give all these vaccines to children? Which are important, which are not important? And why don't we get all of them in the government sector vis-a-vis the private sector? So these are questions which comes in the mind of parents. Which vaccine should I give? How many doses? Where to take, etc. So what vaccines a child should receive depends upon which area the child lives in and the diseases which are prevalent there. So what vaccines should your child receive? At the first visit, the baby needs to get 3 vaccines. The first is the BCG, which is against childhood tuberculosis. Then we have the zero polio or the oral polio vaccine, which is for polio. And we have the hepatitis B, which is for a severe form of liver disease or jaundice. These 3 vaccines are given anytime after birth up to the age of 1 to 3 months, but it is preferable that it is given in the first 15 days after birth. The next visit entails another set of vaccines which are repeated at the age of 1.5 months, 2.5 months and 3.5 months. So the vaccines in these 3 categories include the DPT, the polio vaccine, or the Hib vaccine for meningitis, pneumonia, etc., and the hepatitis B vaccine. The DPT vaccine comes in 2 kinds. One is the whole cell vaccine, which is the diphtheria, pertussis, tetanus against these diseases, and the second is the DTaP vaccine, which is the acellular vaccine. This acellular vaccine is commonly called as the painless or the imported vaccine that is available in the market. If you ask me truly what is the difference between these 2 vaccines, the difference is only in the pain and the fever component, and there is actually no difference in the efficacy in the 2 vaccines. So we need to give 3 doses of the DPT, Hib and the polio combination at 1.5, 2.5 and 3.5 months. Just like how DPT comes in 2 forms, we have polio also, which comes in 2 forms. So you have the oral polio vaccine and you have the injectable polio vaccine. Studies have shown that the injectable polio vaccine is in some ways superior to the oral polio vaccine, especially when it comes to its efficacy and protection against polio. So I would recommend that you take injectable polio vaccine. The choice between DPT and the DTaP vaccine remains solely with you because there is no difference in the efficacy of the 2 vaccines.